So case number 2 is again a 2-year-old with respiratory distress. This child again has come to ED and the child presents with the respiratory distress. There's some fever and some sort of a wheezing. So for this, the child has been sent to the X-ray room. We have done the X-ray, and then my resident has read this X-ray. So what are your thoughts now? So this is a normal study. There is a left-sided pneumothorax. There is bronchiolitis. There is collapse of the left upper lobe. These are our choices. So let me go and open the X-ray and read it. So you have the trachea, which is seen here. You do not see the tracheal bifurcation. The cardiothoracic sellout is rightly narrowed. You can see that the narrowed cardiothoracic sellout here. You can see the prominent bronchomuscular markings appearing like peribronchial thickening. You do not see any consolidation. You do not see any collapse. Bilateral dooms of diaphragm, they are slightly flattened. The cardiophrenic costophrenic angles are sharp. No pleural effusion. It's actually, if you look into, there is mild hyperinflation. You can see the lung apices bulging outwards. And then you have this line that is almost like a white line of pleura extending from the apex going down up to the level of the dome of the diaphragm. So the abdomen seems to be okay, and remarkable that the chest wall and the thoracic cage is perfectly fine, though the patient is slightly rotated towards the left side. So what are your thoughts? What should we say about it? Is this a normal? Is this pneumothorax? It's bronchiolitis or collapse of the left upper lobe? Your thoughts, please. So let's go and see a little bit of evidence on this. So then again, let's get back to the radiograph. So this is an interesting paper. If you see that it differentiates the findings of pneumothorax and the skin folds, you will see that the pneumothorax is actually a thin line, very distinctly made out. It is sharply defined and it is an opaque line. It is very bright. While a skin fold here, actually, on that next image is actually a broad line. You will see it's ill-defined more medially, and then opaque but outlined by a sharp lucent line adjacent to that. You can see that on the lateral aspect. Here they have zoomed it. You can very clearly see that the white line of pleura of the pneumothorax is a very sharp line. You do not see any bronchoscopal markings. The bronchoscopal markings are short, falling short here. They don't go out. While here you can see that the bronchoscopal markings are getting out from the lateral aspect of these two folds. Okay. So these are other various, the differentiators. So in our case, if you go back and see X-ray and zoom, you will see this. What you will see is exactly like what we described for the skin fold. It's a broad line. It is not a pencil sharp line. It's not a white line of pleura, but it is a line. Yes, of course, it is broad. It fades out medially, and then it has a lucent margin. And then on a zooming, you see that there is no, the bronchomuscular markings are not stopped, and then they go out to the periphery. So this is actually a skin fold. Going back again to that X-ray initially, which we saw, if you carefully see, there are many skin folds here in this child. This can happen. This can very much happen. Of course, this is a case of bronchiolitis. You can see hyperinflated lung. You can see the narrow pedicle. You can see peribronchial thickening, perihilar opacities or peribronchial thickening here. No consolidation, no pleural effusion. But at the same time, there is a skin fold which has overlapped here, and it has got caught in radiograph, and that's what we are seeing. Now, skin folds can be very commonly seen in children, especially those children who are having fever, dehydrated, children in an ICU or in ICU setups or where they are quite sick, dehydrated, then, their skin is very loose, malnourished. All these children, they can produce this type of folds. Those are the differentiators. Watch for them. They actually go out of the field of view. If you see that from the lungs, they go down. Here you can see these two lines. That's one of the ways to differentiate them. And you will also find many, if you see, in the surrounding soft tissues. So this is not a pneumothorax, so you should be careful. You should not treat it as pneumothorax because there can be a tube which can cause inadvertent lung injury. So this is our second case, and there are take-home messages from these two cases. The first thing is normal things can look abnormal in children. Yes, you need to be very careful. And the knowledge of normal developing anatomy is very much important when you're practicing pediatric radiology.